Welcome everybody to Benefit with Friends. I'm Lou Bernardi, your host. It's a special 3:30 edition of Benefit with Friends this very gloomy Thursday in New York. And I'm going to bring into the studio with me a special guest host for the day. Joanna, how are you?
I'm well, thanks, Lou. How are you doing?
I'm doing very well. I got my volume working this time. I've made 3 of the 8 episodes. I had myself muted at the start. So, pretty
Well, sometimes you learn the hard way.
pretty embarrassing. So thank you so much for joining me. I sent you an email a minute ago because I know you had a call wrapping up right around now. I was like, I hope she knows she has to click on the link, not just
I
join as a
found it.
spectator. I think there were quite a few people registered. So I don't know if you're out there, welcome to our show. If it's the first time you're here, my name is Lou Bernardi. I call myself a benefit. Well, let me get rid of the background if I can. Let's see. Yeah, there we go. So I'm a benefit optimization officer, kind of a term I phrased. I like it better than broker. I like it better than consultant or advisor. I see myself as part of the benefit decision making team, for our clients. Outsourced, of course. I'm not physically there with most of them, although I feel like I am sometimes. I'm sure you might feel that way as well. We have some clients that we speak to, several times a day, and we love doing that. But benefit optimization is really something that, for me, came to be about 5 years ago, because I've been a broker consultant for, this is my 30th year, believe it or not. I got my license when I was still in the crib, and of course that's not true, but I wish it were. And for 25 years, I sold insurance like a lot of people out there. I was a general agent. We've had this conversation, I think, 1 or 2 times. Never in New York, right? We've been in Phoenix together. We've been in a couple of different places. I forget the first time we met, and yeah, probably
Orlando.
Yeah, exactly. So, and I was just there again, and I was disappointed that you weren't there. I saw Garner was I think you were a sponsor, so I thought there
Yep.
would be a table there, but you can only go to a certain number of these events. Sometimes you have to stay home and work. But you know, today I'm really excited because a lot of times we're talking about solution partners. Sometimes I feel like I almost like paint myself into a corner that all we do is self-insurance, and that's simply not the case. It's a strategy that we use, and I'm sure that I know that Garner can be used um, to coincide with self-insured plans as well, but it's not the end all be all. And here in New York, because of the state regulations, a majority of our clients, from a quantity standpoint, are fully insured because they can't go anywhere else. They have less than 100 employees. So fully insured community rated market is the only place they can be. And, what's really nice about this last 5-year journey that I've been on, with a lot of the organizations like Health Rosetta and Aspirational Healthcare, is that occasionally we come across solutions that don't have any specific niche, that they can help really everyone. And I'm gonna pull up a slide here. Should put us there, and go back to slide 1. So, when I talk about benefit optimization, because people ask me occasionally, what is that? It sounds pretty evident, but I actually found this in the HR Daily Advisor. Benefit optimization, as the name implies, is the process used by HR professionals to critically assess the organization's benefit structure and determine what changes can be made to make the benefit package on offer best serve the organization and the employees. And I think it's an amazing resolve. It's a great in theory, but I think far too often there just isn't enough time for a lot of HR professionals to focus on really digging deep into the products that they're ultimately offering. And far too often the advisors or the brokers that they're are selling to their expectations, not really necessarily trying to raise everyone's expectations. And I think you and I are pretty aware that there's some amazing solutions out there as an alternative to the traditional health insurance products, or to supplement those products, right? Because we're not going to eliminate the need for insurance for most of our clients, even if we're self-insuring. There's a level of insurance, that stop loss insurance. So, these are the 8 core, I think, issues that I came up with the status quo. And they're a lack of price transparency, lack of quality transparency, low provider patient engagement, 30% markup on prescription costs, which, of course, because there's no transparency, most people don't really see the true cost of the medications, and in some cases really significant tens of thousands of dollar rebates monthly that go back into the pockets of the insurance carriers. Healthcare steerage, right? Misaligned incentives, no control of the plan document, which is maybe more, well, it's always the case in fully insured environment, and sometimes can still be an issue in the self-insured world. And then unnecessary care. And I think when I first saw Garner and talked to Steve, who I was connected with, I think, through United Healthcare days, I couldn't believe how many of the things Garner potentially checks off here. And it's just really pretty simple. And I'm going to take this slide down here for a second. So I'm going to stop for 2 seconds or more and allow you to introduce yourself,
Yeah, of course.
introduce Garner to everybody, and then we'll take it from there.
Yeah, absolutely. And I really love that slide, Lou, because specifically as you were reading those out loud, I was like, yep, 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 yep. We can help with, almost all of those things, if
Yeah.
not all. And so I'll introduce myself for a little bit for those who haven't met me before and I haven't had a chance to meet. My name is Joana Ames. I go by Joe. I'm a senior sales executive at Garner Health. I live in Rhode Island, small state of New England. We are a New York headquartered company, but have employees across the country. I also spent many years on the carrier side, so worked for both ancillary carrier and most recently a medical carrier, like Steve, UHC, you mentioned. And so, have always been used to being one of the levers that brokers and consultants pull, kind of price shopping, looking around at different carriers for their employers. And what I really loved about Garner is that we are such a unique solution in the market that can really play with all clients. So whether you're fully insured, you're self-insured, level funded, whatever type of pricing arrangement you're in, and whoever your carrier, your TPA, your administrator is, we can work with you. And we are solving the need of steerage, of aligned incentives, and really arming members with tools and resources for finding providers. So at a high level, what we are is we're a simple plan addition, and we combine data science and incentive accounts to drive patients to the highest quality doctors within their network. So you are an employer with 20 employees, or you're an employer with several thousand employees, again, self-insured, fully insured, level funded. We understand what in-network means to you, and then we provide your members the tools and resources to find the highest quality providers in their network. And we all know that with quality, you're getting better claim cost, you're driving better pricing, everything that matters is who you see for your care really matters, and that's what we're trying to solve here. So I'll stop there, but at a high level of what we're doing here.
No, that's great, because and we'll get a little bit more into it in a second, but I'm in the process of writing a book about managed care, and I always say it's taken me 30 years to get 5 years experience, because I sold insurance, and that was pretty much what was expected of me. I was very good at selling insurance. I was, come in with renewals, very competitive, great relationships with my clients, some of them for, close to the 30 years that I've been in business. And then I don't know exactly why, but about 5 years ago, I stumbled across something online that showed me the price, the true cost of healthcare. And it was probably something to do with the Affordable Care Act, because that's kind of where it stemmed from. The Affordable Care Act, one of the, you can challenge whether or not overall it's been a success, but one of the great provisions, I think, was the mandate of the release of claims data. And it was just information overload, right? It wasn't coming to anybody. It wasn't like, or you can just go to your email and you could look something up. But technology companies really were paramount in being able to take that data, figure out what it meant, help to identify the quality of care, try to understand why the prices for the same service are so substantially different in different parts of the country, but more importantly, where you're getting that care. The point of service is really incredible. And then it just really just snowballed from there. And then I realized that, the insurance carriers, especially over the last 10 years, have shown very little ability to control cost, control premiums. There's this thing called medical trend that they allowed when they have their renewals, especially large group renewals. It's like, what is medical trend? And then you ask them what it is, and they just give you a number, 10%. Costs are going to go up 10% this year. But why? If you're so dominant as an insurance company, we know who they are. I'm not going to, the Bucas, right? They all know who they are. Why aren't they doing a better job controlling costs? And of course, the answer is it doesn't benefit them to control costs. They make more money when claims go up. They make more money when claims go up because they can justify further premiums and higher premiums. If you're getting a 3% profit off of $1 billion, that's going to be twice as much as 3% off $500 million. So really,
and then there's the underlying provider contracts and all of that as well. Yeah.
Well, and getting to that point, the health care ecosystem has really changed that much more dramatically over the last 30 years. Because in the beginning of managed care, most doctors were independent. There were definitely practices out there. Most hospitals were independent. But because in the early days of managed care, the health insurers had all the leverage on behalf of their several million members, they were truly, holding costs down, and trend was much lower. The healthcare system had to do something about that. So what they started doing was merging. And they started merging initially horizontally, hospital to hospitals. Doctors started merging with each other and building bigger practice. So they had more contract leverage when it came time to renew those contracts that you just referred to. And then the mergers started to become vertical instead of horizontal. The hospital system started to realize, well, we need to drive more services into our facilities. So they started to pick off, I would say, or just absorb all of the other different levels of care, all the way until most recently, over the last 10 years, they've absorbed the primary care doctors. And now they have it all. And those doctors now work for them. And those doctors, and I'm not speaking badly about doctors now work for the healthcare system. They have quotas to meet. And when they do have to refer people out, they refer to them to where they're told, not necessarily where they would have done it under their own free will. And too often those services are referred to the facility where the insurance is going to pay 3 to 5 times. Let's just say, use something as a reference as Medicare's rate. And that's where it really becomes, so incredibly, sinister, really. So what I love about Garner, and getting back to that, is that what Garner is in my mind, I'm going to pull up a slide from you guys, right? So you mentioned it's a simple plan addition that drives more care to the highest quality doctors. So if you could explain it, it might be, there's probably about 5 slides here. I put this together without telling you from stuff you shared with me.
No worries. I like it.
So there's billions of point of claim data. If you want to, maybe, I don't know if you can talk to that about, like, where's Garner getting their data from? I think it's important for people to understand these aren't Garner's doctors. Garner doesn't have a network. These doctors probably, I would imagine, unless they know about Garner and they check it out for themselves, they don't know whether they're on Garner's list of top performing providers, right?
Yeah.
They're not changing their behaviors to get there.
Yeah, so you're absolutely right. I think that's what makes us really unique in the market is, first and foremost, we're not an insurance company. We're not contracted with providers directly. Providers aren't paying us to be part of our recommendation platform. We are aggregating medical claims data from pretty much every source out there. Again, because we're not an insurance company and we're not contracting with providers directly, it puts us in a unique position competitively to aggregate claims from employers, clearinghouses, insurance companies, all paired claims databases. Most of the medical claims that we examine are commercial. However, we are a CMS qualified entity, so we do take a look at some Medicare claims. We do think it's important to take a look at how providers treat that population. But when you aggregate all those sources that I just mentioned, that gets us to about 61% of all claims nationally. So we really can look at, all providers across the country for all non-emergent specialties and really take a look at the way that they practice medicine. So you mentioned earlier, where you go is important. And I'll even challenge that it's who you go to. Any
Absolutely.
facility or provider group or hospital, any location that you have access to with your medical plan within that, facility, call it a provider group, call it a hospital. There are underperforming providers and there are high performing providers. And it's, kind of baffling to think about how people look for providers today, right?
Mhm.
You Google online, you ask your
Google.
coworkers, you ask your family and friends, right? It's this Yelp versus like everything else. People are obsessed with getting information before they purchase something, where, I feel like finding medical care, it's more based on word of mouth and recommendations that way versus, with Garner, the biggest thing that we do is we arm the individual with real data and information on providers so that they can make an informed decision on who they go to see. So a great slide. I love this slide, which
Yeah.
really summarizes what we do. So three buckets, first and foremost, we identify the highest quality doctors in your network across the country, across all non-emergent specialties. Again, I mentioned the 61% of claims. That's about 45 billion claims. And then the second piece is, arming individuals with that information. How do we do it? We have an app, we have a website, and then we have our most powerful tool, which is Concierge. We have
Mhm.
a team of US based Garner employees that pick up the phone and answer inbound chat messages from our members to help them find the best doctors for any care that they need. And then the third piece, which I know you love, Lou, is that incentive model. So this is a new tool, a new resource for employees. How do you get people to actually use it? And how do you get engagement? Where you tie an incentive to it. You reimburse individuals for their out-of-pocket costs and reward them when they take a Garner recommendation and see a provider that we recommend. So like you have it on here under the hood, the mechanics of that are HRA, but this is the first time we've mentioned HRA on this
I'm
podcast.
going to
And
get to that in a second because that's really
yeah,
important, right? It's not just navigation. This isn't just a tool
exactly.
you're giving someone saying, here, use this, find the best doctors. The incentive part is so crucial. So, I'm sure that, out there, and I think there's quite a few people on the call today. And if you are, on the call and you have a question, you can put it in the chat. I should be able to, see those messages. But, at its core, Garner is a concierge navigation support tool resource that allows people to find the best doctors. And isn't that what everybody wants? I mean, really, I don't know how you would really, find a doctor other than just get a recommendation from your primary care doctor. If you're lucky to have a primary care doctor, I think as 40% of the U.S. population, adults now in the country, don't even have a primary care doctor. They have no relationship with a doctor. When they get sick, they go to urgent care, right? But as a result of the plan design changes, that perpetual pay more, get less, that's really plagued managed care plans for the last 20 plus years. A lot of employers out there found that they had hit the ceiling. They had nowhere to go other than to make significant plan changes and we'll just use the metallic levels, I guess, that are used in the small group market. Maybe they were trying to hold on to a platinum plan for as long as they could, or a gold plan for as long as they could. And they just couldn't do it anymore. It was really, it was really hurting their business, and they made a decision where we need to save. So a lot of employers out there went for a high deductible health plan, in some cases an HRA compatible health plan. And now they said, well, we don't want to just make the plan change. We'll have a mutiny on our hands, and we really do care about our employees. So we're going to cover a portion or potentially even all of that exposure with an HRA, a health reimbursement agreement, where they said, we're taking you from 1,000 deductible to 4,000 for an individual and twice that for a family typically, but we're going to cover all or part of that. So they saved a tremendous amount of premium, hopefully, a bucket of money, and now they've promised back to their employees that they'll cover the out-of-pocket cost if it's incurred. So it's the employer's money to hold on to unless it's incurred. And there's companies out there that project that, you're going to pay back 25, 50, 60%, depending on the way the plan design is created. You're going to pay that back to your employees, and you're going to hold on to X amount. But what they haven't done, going back to my 8 core issues with managed care, they haven't done anything to address the steerage problem, right? They're still paying for $3,000 MRIs because every time you need an MRI these days and you have a doctor who works for the healthcare system, they're pulling out a slip of paper that they've been given by their healthcare, their new employer. This is where you send people for your MRIs. You're not allowed to tell them that they can go to the independent radiologist down the block for a quarter of the price, right? It's not there. It's unfortunate, but they can't do that. They whether it's in their contract or just understood, they're going to follow the rules of their provider because they have quotas that they have to meet. So what Garner does is they step in and say, okay, we're going to offer you the HRA, all of the benefits of HRA with the concierge approach and the guidance towards a high quality provider, and it will cost you significantly less to fund that cost because your employees only get the HRA fund money if they use the Garner, and it can't be accidental, right? You have to engage with Garner. And for me, the purpose here and what makes it beautiful is we're starting to change the consumer habits in a positive way. It's just not, well, if you want your $2,000, go here. It's go here because it's best for you, because these are the doctors. And when you do, you'll be rewarded for making that good decision. So it's really, really, so I wanted to backtrack and talk about the HRA component because that is essential,
Definitely.
to the core of this.
Definitely. I mean, for a long time, employers have, to your point, self-funded their
Mhm.
deductible with an HRA and just blindly given out the dollars to individuals as they access the healthcare system. And really what we're doing is revolutionizing that and saying, you can give those funds to your employees, but spend those dollars in a more meaningful way and
Mhm.
give it to them when they're actually going to change their behavior, engage, and go see high quality providers, which is ultimately going to reduce spend. It's going to be good for them and then good for your plan, right? You're going to reduce
Right.
your claim costs. And then, as you mentioned, and by the way, Garner can administer it. They can offer these tools to your employees and they can guarantee the cost of what funding that incentive is going to be.
Well,
So,
that was the next point. That was the next point because my first analysis was a company with about 60 employees covered under the plan. They had, probably closer to 100 employees, but 60 employees covered. They had made the decision to go from a platinum style plan to a silver level plan, maybe even bronze, but I think it was silver. And they were covering the entire 100% of the out-of-pocket cost. Their exposure was, I'm just going to say, I don't have it in front of me, $150,000. And they had paid about $100,000 back. And they weren't even sure with their administrator if they hadn't even come closer to the $150,000, which is really, it's pretty uncommon. When I showed them the Gartner approach and the cost, and I don't know if this is the actual number, but it was about 30% of their maximum exposure. That's the fixed cost. So, the other important thing for someone out there that would want to talk to you guys about Garner is that not only are you addressing, the cost, you're addressing the navigation, the transparency, and now you're not just saying go to the doctor. You're showing this is why. Going back to that last slide, you know, you're telling them this doctor's in the 90. It's a little blurry, but 97th percentile for great outcomes for back surgery. 98th percentile for attempts non-surgical treatment first. And those are some of the things. It's not just that a doctor's a great surgeon, but they do surgeries when they're necessary. They don't overperform surgeries. There's a lot of tools, not like this, but there's a lot of data. There's a lot of companies out there that can give quality matrix, but a lot of those are focused on self-insured accounts, large group accounts, and they don't put the power in the members' hands as easily as you do. It requires case management and a lot of those type of things. So from a cost perspective, it's really significant. So I was looking at this slide, and it has some names on here. So we're not trying to but this is the truth. Like so we're in New York, and I love this slide because it's New York related. Is that Garner uses over 45 billion claim records to identify physicians that produce the best health outcomes, which lowers healthcare costs. So normally someone might say, well, we're going to pick our provider based on the facility, the hospital that they use, right? And there's great doctors out there that have admitting privileges to all hospitals, right? It's not really the hospital that's performing the surgery; it's the doctor that's there.
Yeah.
You can have in Orlando, when I was just there, I was speaking to someone, and they showed us some slides. It was actually a TPA that we work with. They showed us some slides about a back surgery, and there was one that was a knee replacement. And a member was about to go to this doctor, was referred to this doctor, and the doctor came back, and they looked at it, got approved by the insurance company. The insurance company said, okay, yep, you can have your knee replacement with this provider because they're licensed to do it. But they're in the 15th percentile of all surgeons. The hospital we have no problem with. The hospital that you're planning to have your procedure done at is a terrific hospital in the 90th percentile or better. But we can't really suggest. I would prefer that we almost don't allow people to go to doctors like this. But we're not gonna twist their arm behind their back. They said, would you like a recommendation to a high performing doctor that has admitting privileges to the exact same hospital? And the answer was, yeah, of course. That makes sense to me. I didn't know that was possible, which is a shame.
Yeah.
And the recommendation, and there were 3 or 4, the one that this person went with was the partner of the initial doctor. One doctor apparently is a shoulder specialist, but he'll do 1 or 2 knees a year.
Right.
But he was in the top percentile for shoulders. His partner was the knee specialist, but wasn't available on the date that they were going to do it. So could you imagine that they decided which doctor was going to do it based on the date, not the one that was most suited for this person? I don't know about you, but I don't want to limp the rest of my life. I'd rather
No.
pick a different day. I'll go in on Tuesday instead of Thursday.
Exactly, and that happens a lot more than you think, and I
Right.
think you said it perfectly, like, this is an easy way to start changing behavior. We're not you can add Garner to any medical plan, and you're not telling employees you no longer have access to XYZ hospital. Like, I'm in the New England area, everyone, I knock on my neighbor's door. They'll say, you ask them, where's the best place to go? MGH, Mass General in Boston, which is also the most expensive hospital. We're not saying don't go to MGH. We're saying if you want to go there, let us tell you which provider is the best for the care that you need,
Right.
right? Who has the most experience, who has who performs the most appropriate care and has the best outcomes.
Right.
So you're exactly right. It's the easiest way to change behavior and give individuals, to your point, the information, right? If you want to know that information, where do you go now to find it, right? Most people, like you and I, are lucky that we know people, we're in the business, we can probably get answers. But if you think about, the average person who is searching for medical care, their resources are really limited in the information that's available for finding a provider.
Yeah. And I'm just showing this last slide before we get to the next point. And this is how easy it is. You can use your mobile device, say, hey, I'm looking for, a spinal orthopedist. I've completed a list. They send it over. You view the doctors. And from my understanding, and correct me if I'm wrong, Garner captures that interaction, whether you're using your mobile device, or if you can call Garner. Right? You can call. Maybe someone's not tech savvy, doesn't want to use their mobile device, wants to speak to another human being potentially, just to know that this is legit. That it's not like just a bot sending back to random doctors. Has some additional questions that maybe the app, doesn't have the capability to address. But it captures that. Now you go to the doctor. You have your procedure. You get your invoice. You get your EOB. And you submit it to Garner. It acknowledges that, yes, used a doctor, there was an interaction with Garner, and you get reimbursed for your out-of-pocket, or can it also pay the provider if you haven't paid the provider already?
Yeah, that's a great question. So we have a couple of different ways that we can work with clients, and without getting too much into the weeds, if we are going with our member initiated claims model where the member is submitting a claim to us, they have the choice of whether Garner pays the provider or if Garner reimburses the member directly. So, a lot of our clients are on that model, and it's ultimately up to them on a claim by claim basis who we pay.
Okay. So, now talking about like, why is this important? Obviously, it's important because we want people to get the best care. I mean, fundamentally, it's why we changed everything that we do here at BrightPath, right? Because we know that we can now. We know that the claims aren't just the claims. We know that the data is out there, and companies like Garner, tech companies really use those billion. I'm not sure about you, but I don't have time to go through billions of claims, and I couldn't even imagine what those records look like. I'm not going to do that. I can't do that. But really smart people have made it as user friendly today as it possibly can be. Why shouldn't everybody have this tool, right? And so now getting back to why is it important for the employer, right? Because it's hopefully for the employer, it's also about their members having the absolute best healthcare, right? They provide insurance. That's not healthcare. Insurance is the financial vehicle to pay for that healthcare risk of your employees. You want them to have the absolute best care, and the misalignments of the healthcare system and the health insurance system make that difficult, way more difficult than it should be. And there's a lot of people out there, like myself, like you, that are really committed to changing that. And it's going to be slow, but hopefully steady, and it will happen. But it's only going to happen if the consumer says we want this, right? This is an industry, right? If people liked horses, we wouldn't have automobiles on the Long Island Expressway, right? If people liked burning candles in their house, we wouldn't have electricity, and probably that would be better because my electrical bill is ridiculous. But the consumer is king. At the end of the day, we just haven't acted like a consumer in a very long time when it comes to healthcare and health insurance. We're just kind of following along because it's become so complex that the conversation is tricky. A lot of people want to avoid this conversation. You just can't avoid it any longer. I know a lot of employers, and I look at their plans and I can't help but think, how did they get here?
Yeah.
In the early days of managed care, when I was selling insurance before managed care, believe it or not, before networks, they were indemnity plans. You may not have seen those. I'm assuming. But there were no networks. And then all of a sudden there were. And I'm walking through New York City with these directories that looked like phone books. I was in really good shape then. And, they weren't online. You had to have printed directories for every employee. Even something as simple as that has changed so rapidly. But, back in the early days, we had $5 copays, $10 copays, 100% coinsurance, 100% hospitalization. The
Right.
emergency room might have been $25. And now fast forward to 2022, there's not too many companies with those benefits. However, they're starting to come back. When you think about Garner, you can take a plan that has a pretty significant out-of-pocket cost. And by using Garner, you can imagine this as an employer. Well, here's our plan. Here's our underlying health insurance plan. That's why I love when you say it's an add-on or a supplement,
Yeah.
right? It's an add-on. Here's the underlying plan. And here's our way of making this plan significantly richer than the underlying insurance plan. And in some cases, employers might say, I'll cover the entire out-of-pocket cost. And Garner makes it very feasible to do that from a financial standpoint, right?
Yeah. And
One of the
anything in
first,
between, like
yeah,
fully
anything.
covering it or partially covering. And exactly, that's the beauty of it. It's not, you know, no one disagrees. Whenever we talk about this, no one disagrees that this isn't important, that steerage isn't important, seeing high quality providers. But what's always been difficult is implementing this in a way, as you know, employers are, they don't want disruption. They don't want, they want things that are better, but are cheaper and minimal disruption. And this is an easy way to add something and then give the individual the choice, right? You can
Absolutely.
continue seeing the provider you want to see, but you could also see a better provider. And here are all the incentives tied to that. So
Yeah.
it's a really easy way to start changing behavior in a meaningful way.
Right. And if you think about how this affects the insurance, right? So in New York, we're community rated up to 100 lives. So we can't change the premium. But if you're over 100 and you're fully insured, your renewal is based on the claim spend, right? So, I remind everybody, don't think about it as a premium. Your premium is a stack of all different things. And it all starts with the expected claims, right? The medical and the pharmacy claims. What are those expected claims based on this population, especially if you're manually rated? And then we're going to add 20% to that because the insurance carrier is taking the risk. And then they have this pooling charge, which is another layer of protection for the insurance company. A lot of people don't even know what that is, but it's built into your
Right.
plan. And if you're a large group, you should have a renewal worksheet that says, claims, pooling charge, taxes, fees, retention, commissions, all of these things. That's your premium. But if you lower the claims, everything else also in proportion should come down, right?
Absolutely.
So if you can use Garner and you say, hey, we're going to reduce our claims over time. If you reduce claims by, I don't know, is there a number? I mean, I know it's kind of early on, but what typically, what kind of impact do you see on the claim spend?
Yeah, that's a great question, Lou. And for anyone that's on the call that's interested, we have definitely a lot of plenty of case studies we can share for both fully insured and self-insured clients that have been on the books, over a year, and we've gone through renewals, not only Garner renewals, but to your point, their medical renewals. And
Sure.
I'll comment a couple of things. The two things that impact how we impact medical spend is going to be engagement, right? And the size of the incentive account. How many people are using Garner? And that's correlated with, how large is that incentive? Are we talking $1,000? Are we talking the entire out of pocket maximum for the plan? So all those things, play into
Sure.
how many people use it and the savings. But we're seeing, when we're looking at our self-insured clients, we're seeing savings from anywhere, from 3 to 8%. And for our fully insured clients, we're looking at savings anywhere from 5 to 20%.
Yeah.
And then how that specifically translates to their renewal varies on, exactly to your point, their actual renewal formula, their
Right.
plan design. But again, happy to share specific case studies with anyone interested.
No, that's amazing. And I think for self-insured, which is a different kind of arrangement, right? Financial arrangement. It is more of a per employee per month, right, thing. But if you think about one of the core things about self-funding is stop loss.
Right.
Stop loss carriers must absolutely love this because if they understand it, right, and the results are starting to come back where you can, catch a stop loss underwriter's attention, say, hey, this is what we're doing. And it is new. Let's sit down and explain this to you. We're changing the behavior. We're getting them to the best providers. Those providers are going to, not only are they just the best at like I said before, performing the surgery, they avoid unnecessary care. They have better outcomes, less readmissions, less infection rate, all of these things that are really crucial. So that's got to be worth a decent amount of credit for a stop loss carrier. You have less claims that are going towards the aggregate because you're paying them from a separate pool. So it really can be very impactful there. But at its core, what I love just the most about it, and you know, I should be on your payroll. I've told
That's
I
true.
have told 1,000
Hey, you
people. I
got to
don't have
take that up
1,000
with
clients.
Steve. You have to take
I
that
know.
up
I'm gonna
with
get Steve. Steve, I gotta go into the city and see Steve one day.
Yeah,
I absolutely love it because it's 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 just so aligned with our mission.
for
Get
sure,
people the
for
best
sure.
care. Reward doctors for being the best doctors, right? Those doctors deserve more patients, right?
Yep.
They deserve, long waits in their waiting rooms. It really is. I mean, it's just so misaligned, all the incentives. We don't want to pay doctors for doing more procedures. We want them to pay them for doing them right. And they should be compensated, fairly, should be very transparent. That's a separate conversation at the end of the day. So yeah, this has been great. So I didn't have a chance to tell you. So I like to end all of these calls basically with like maybe 3 takeaways for for the listener. If there's anything that you think about specific to Garner or just things that you've observed because you've been so close to the health insurance and healthcare world, anything that you'd like to share with the folks out there?
Yeah, it's great. I mean, I think the one thing that I always say is, that's really important to think about is, think about how you find a provider today and how most people do. And I think when you really sit down and think about how people search for care today, um, versus how they shop for other things, it's pretty eye-opening. And so, I don't, like I said, I don't think anyone disagrees that these tools and having this information is important for individuals.
Mhm.
And there just aren't, there aren't players out there, there aren't solutions that can work with all types of groups, right? We're carrier agnostic, funding arrangement agnostic, small, mid, large will work with you. So I think that's, the one thing. And the other thing, reach out, do you have questions about how this works? How can this be a fit for you as an employer, your clients? Go on our website. We have plenty of case studies. You and I can talk on and on about the Garner solutions, but
Yeah.
definitely check us out. Leverage us. Reach out to me. Happy to have further conversations. And then again, exactly to your point. I'll end with a story. And so this is a real story. I actually, when I do my demos, I'll pull this up because it's really personal to me. Those who know me personally, my husband and I ski a lot. We spend a lot of time in Vermont, and he unfortunately recently, someone ran into him on the mountain, and he fell pretty hard on his snowboard, and thought he was okay, but then ended up having, a lot of lingering back pain. And he has some resources through his employer as well, sort of like concierge, help me find a provider. No real quality or data tied to it, just helping them find a provider. He was recommended an orthopedist, a back pain specialist here in Rhode Island. We looked him up, head of the department, professor at one of the schools here, and I was like, hey, I'm going to use Garner. I work here. Like, let's get some information. And some of the metrics that were shared with me, I'm like, wow, that's not where I want my husband to go. And being able to get alternatives for a couple of providers that would be better, and seeing their success rate, how many of their patients, after treatment are still in pain, we're really alarming. So, that's information that everyone should be able to have. And I'm really proud of the information we give our members, and the way that we're changing behavior and healthcare.
Yeah, no, and you brought up a point that we didn't actually discuss is the fact that this takes into account your insurance carrier network. You know, most companies are still using networks, right? They're kind of synonymous with healthcare, although they are completely different, right? If you have a network, you actually have a limit to the number of providers you could see, as opposed to the indemnity days. There wasn't a network. You had free choice. As long as the doctor, had an appointment, you could pretty much see him. If you have United Healthcare, if you have Aetna, if you have Cigna, if you have Humana or Kaiser or any other number of insurance companies, that's going to be taken into consideration when Garner makes their recommendations, right? They're not going to send you to a doctor that's not part of your network. And that's crucial, right? We want this to be, intelligent technology that really can be used over and over again, so that we're changing the habits, so it's easy, that there's a financial incentive, it benefits the employer. It actually, I spoke to an HR director recently and said she gets so many employees every week. People are coming in and asking her, I need help finding a doctor. Because even the insurance carriers networks themselves can be very complicated. When you go on
60% accuracy. We have that on one of our slides. The carrier directories are about 60% accurate, and we get that to 96% accurate. And if you use concierge, it's 100% accurate. So,
well, and the other thing is that half the time when you go there, most people don't log in, right? So they're not registered on their insurance carrier website. When you go to the website, there's a drop-down box. Pick which of the networks do you have. People don't know what network they have, right?
Yeah.
If you have United Healthcare, you might have the Choice Plus network. You might just have the Choice network. There's literally probably 25 different networks on there. And we've had people that went, well, I checked it out and they were on the website. And when we looked further into it, like, they are, but they're not on your plan.
Right.
They're on the state government plan. They're on the the individual marketplace plan, whatever the case might be. That's
too complicated.
really important.
Yeah. And what I'll add with that is that's also why we're great to work with, because it's easy. The two main things that we need to know are, what's your network, right? So when an individual uses our tools, they don't have to tell us the network. We know, right? And we are only going to make recommendation network. So what's your network and who's on the plan, right? Eligibility. So those are, like, not only are we a simple plan addition, we're also really easy to implement, because if you think about what we're doing, we just need to know what's your network from an employer standpoint, and who's on your plan and who's going to be eligible for this benefit. So it's a very low lift type of program.
Well, awesome. This was great. Thank you so much. How's the weather in Rhode Island? It is absolutely miserable.
It's gray here, rainy. Hoping to get one last ski weekend in this weekend, but we'll see. It hasn't been a great winter, and it's gross here in Rhode Island.
It's the same here. I thought spring has sprung, but no, we were tricked again, as we usually are. So anyway, thank you so much. Talk to Steve. If you talk to Steve, tell him I said hello.
I will. I appreciate you inviting me. Thanks for everyone who joins. Great to virtually meet you, and feel free to reach out to me on LinkedIn, and hope to be in touch.
Sounds great. I appreciate it. Thank you so much.
Thanks, Lou. Have a good one.
Thanks. Bye-bye.
Bye.